the webinar is live.
Hello and welcome to the Sentencing Project's webinar. Thank you so much for joining us. We are going to be having an examination of the impact of COVID-19 on incarcerated people and explore how advocates can utilize Congress and advocate for change and improve conditions for people who are incarcerated across the country. I'm really happy to join you. I'm happy to be dressed up and sitting at my kitchen room table. I hope all of you are healthy and keeping safe in these really difficult times. I'm really pleased to be joined by a great group of speakers who you're going to hear from today. But I'm most pleased to have an opportunity to introduce you to Congresswoman Karen Bass, who's going to give us an update on what she's been doing in Congress and what she hopes to see happening. Ms. Bass represents California's 37th Congressional District, and she is a senior member of the House Judiciary Committee, where she serves as chair of the Subcommittee on Crime, Terrorism, and Homeland Security. She's also the chair of the Congressional Black Caucus and has been a longtime champion for criminal justice reform and an ally to the Sentencing Project. We are so thankful to have you with us, Congresswoman, and we look forward to hearing your thoughts about how this pandemic is impacting incarcerated people and what steps Congress can do to aid them. Once we hear from you, we're also going to have a couple of questions after. I should say my name is Kara Gotsch, and I'm the Director of Strategic Initiatives at the Sentencing Project, and we're so glad to have you.
Well, thank you very much, and it's my honor to be with you, and please never hesitate to call on me. I feel like I have either been associated with or supportive of the Sentencing Project from the beginning. Your work is absolutely vital to what we do. And let me just say that we're in such an interesting time period in our life where we're all going through this experience together, not just as the country, but actually as the world. And it's an opportunity, I think. The crisis, as tragic as it is, does present an opportunity for us to raise some questions and try out a few things. But I am deeply, deeply concerned that the people that are behind bars are being forgotten. And I'm very concerned that we're going to have a death rate, and that's the way we're going to reduce the prison population. I just think it's absolutely horrific. So just by way of background, I've been working on this issue for several decades now, in the 80s and the 90s, trying to prevent what was so obviously going to lead to mass incarceration when we watched 3 strikes and all the laws come into play around crack and all of that. And then, you know, trying to fight the worst parts of it so that we reach the place that we're at now, where there's actually bipartisan, I will say interest. I can't say agreement. We were able to pass first step, and we do know that we have some interest in criminal justice reform on a bipartisan basis. But now I'm very worried about that being dropped, and a situation where we're telling the entire country that they need to practice social distancing and they need to practice hygiene in terms of hand washing and all of that. And that's the exact opposite of the situation that's in our prisons and jails today. And so I believe, in the Congressional Black Caucus is calling on a whole variety of things related to criminal justice reform, and I'll be happy to send it to you. But most notably, we're calling for early release. We think that people who are within a few months of being released should be released. We think that pregnant women should be released. We think that children, and you know, I hate to isolate it to children who have not committed murder, should be released. I think it's crazy that people are in jail right now for bail. I think it's also crazy that people are in jail and prisons because they had some kind of technical violation. And so the opportunity that is presented now with all of you who I know are listening, who are interested and committed to bail reform and criminal justice reform, I say that we push for some of those things right now in terms of releasing people on bail and for technicals, and that we look back at it long term and demonstrate that if you release people on bail just because they couldn't pay for it, they're not going to all flee to Europe. They're not going anywhere. And we have an opportunity to demonstrate that if people are released, and then we can show that nothing happened. And so, again, I think I could stop there and take your questions, but I will tell you that the Congressional Black Caucus is also calling for mandated testing, which means that everybody in a prison should be tested. Yeah, it's crazy to say only if you have symptoms and people are locked into cages, and that the testing needs to be with staff as well. People need to be provided the proper hygiene, and they shouldn't have to pay for it. We think that if, there should be treatment available. I am just worried that we are going to see everybody understands nursing homes and that there's a big death rate there. I know we've already seen a lot of deaths in prisons, but I don't think we've seen anything yet if something doesn't happen soon. I don't.
Thank you so much, Congresswoman Bass. We really appreciate your comments. I know all of us are concerned about the dual tragedies of mass incarceration and this pandemic, and those two issues together are, what awaits us is really could be staggering. And so all of us are very concerned and working really hard to try and influence Congress's next moves in the space. So
sorry, I forgot two things. One is it's not enough to just release people. So we are also calling for increased resources for reentry programs. Because my big concern in California, for example, we've released a lot of people prior to COVID, but I've been very concerned about California releasing people and people not having anywhere to go. And then when they recidivate, we're going to say, oh, you shouldn't have let them out in the first place.
Absolutely. Well, I know one of the questions that our panelists have for you involve reentry as well as the release issue. So I'm going to have two of our experts who we're going to hear more from later ask you each ask you a question, including Sakira Cook, who's the director of the Justice Reform Program at the Leadership Conference on Civil and Human Rights and the Leadership Conference Education Fund, and Ahmadou Drame, who's the director of Policy, Advocacy, and Legislative Affairs at the Safer Foundation. If you guys want to take it away, maybe start with Sakira.
Hi, can everyone hear me?
Yes.
Thank you so much, Kara, for inviting me to join this important discussion. And I want to say hello to my fellow panelists and to you, Congresswoman Bass. Our first question for you is really about how Congress, we've seen some movement with respect to the CARES Act on helping to release vulnerable people from federal prison. So the first, and DOJ has been somewhat slow in its response, and you and Chairman Nadler have sent several letters about DOJ's response to this crisis in federal prisons. So the first question for you is, what else can Congress do to help with respect to moving as many people out of federal prison, and oversight that they can provide to move more vulnerable populations of people out of federal prison? And then also, can you talk a bit about your priorities with respect to this population of individuals for Stimulus 4, and any policy changes that you will be pushing for to ease reentry for those who will be coming out of prison? Thank you.
Let me just start with that last one in terms of reentry. I mentioned the resources to programs like the one that Ahmadou has. But in addition, we also need to remove barriers to TANF, SNAP, and public housing. So see, to me, it's an opportunity to do those things too, because when, the war on drugs happened because politicians all wanted to put something on their mail piece that said they were tough on crime. There's so many barriers that are there that were put in place. And so one of them is, well, 3, TANF, SNAP, and public housing. If there's any others, you guys should definitely let me know. I mean, like, for example, the SBA thing that we did, it says if you have a felony, you can't take advantage of it. So, here we are putting new barriers in place. And that was done, excuse me, in the last package. We have a variety of things that we're asking for in this package. And again, I can send them to you, but they do involve early release. They also involve not arresting people right now. In Los Angeles, I'm proud to say that, you know, we are doing a number of items like this. So for example, people are not getting arrested for warrants and things like that, like traffic. I mean, you know, you got people sitting in jail because they couldn't pay a traffic fine. And then we tell people, you know, to have social distancing. So we really need to clear out that. I also want to tell you that next Friday, the Congressional Black Caucus is doing a telephone town hall. And this is where I would really like to ask for your help, because I believe that my colleagues and my Democratic colleagues, I'm not even talking about my Republican colleagues, they are all concerned about the disproportionate death rate. I mean, 70% of the people dead in Illinois are Black, and it's 20% of the population. But I don't think they're feeling the incarceration issue in the same way. And so we're doing this telephone town hall, and the people that I hope get on the town hall are family members who have people behind bars so that they can tell the stories. Because I do think that that's the most, we have got to raise visibility on this issue. And, you know, you do see news stories now, but the news stories are telling what is happening, but they're not saying what the solutions are. They're just talking about, and then I know that it's only the tip of the iceberg in terms of the stories that they're telling. And then you have, you know, the slave labor situation going on, you know, where you're going to make hand sanitizer in New York, but you can't use it. The new prison that is, not the new prison, but the new effort where prisoners in the South, Janice knows which one, because you just sent me the article, who are busy making masks that I'm not even sure they can use. It's just, you know, outrageous.
Yeah, for sure. Well, Congresswoman, thank you again for being here. And Kara, thank you for having us. And then to all the folks out there in the sort of listening universe, thank you as well for being with us. So you have partially answered my question, Congresswoman, but I'll ask it nonetheless. You know, it's been reported that most countries can expect their economic output to decline by about 5% when, for the most part, it was projected that those things would be on the up or positive side by 3% by the end of this year. So there's really some radical shifts that are taking place in the economy. As we know, people who are impacted by the justice system and often re-entering back into society oftentimes face the most difficulty trying to find employment and secure employment. And many people who are being released these days are re-entering an economy that is essentially frozen and in a free fall. And so I'm just wondering if congressional leaders and members of the Congressional Black Caucus will also be fighting for things like learn and earn opportunities, which really will allow people to both gain some income, but also retool themselves and reacquire some new skills as this economy starts to bottom out.
Well, when you say learn to earn, I'm not sure I know what you mean by that, like an apprenticeship program. Is that what you mean?
Yeah, generally it's similar to an apprenticeship model, but essentially there are opportunities for people to learn a new skill, acquire a new credential, especially when economies sort of change. These things tend to be very common. So as we can imagine, like we've got all sorts of things that are at play right now, but the basis of it is basically you learn, you're in a training program or some sort of vocational program, you're able to earn income or some sort of stipend that helps you sustain yourself along the way, so that when the economy does rebound or when things slow down and opportunities open up, people have the skills to take advantage of those opportunities.
I mean, I think that's a great idea. I don't think that we are pushing anything like that right now, but you should send me that idea because it doesn't mean that we won't. I'll tell you, in Los Angeles, we have a very strong relationship with the building trades, and the building trades specifically hire formerly incarcerated people. And in some instances, they start working with them before they come out. And so we've worked on it like that. And I'm just talking about Los Angeles because not everybody has, I mean, some of my colleagues don't have building trades because they don't have unions, you know what I mean? But so we're all kind of working on it in a different way. But, I mean, I know that a lot of you wouldn't necessarily remember this because you're younger, but, it wasn't always this way. I mean, we actually used to have training and stuff inside of prisons. And, you know, I remember when you could get out of state prison and matriculate to state college. It was just when we changed from rehabilitation to just straight punishment, where things changed and all of those resources were taken out of a prison. And then we passed all these laws to ensnare more folks. So please send us that idea, okay?
Certainly.
Thank you so much, Congresswoman. You know, I know many of us on this call today in the audience and the speakers today are part of something called the Justice Roundtable, which is a large coalition of organizations who are committed to ending mass incarceration and addressing issues around the federal prison population. And we've shared recommendations with you, and I know that you have embraced them, and we really do thank you for your support for that. So thank you so much for joining us. We really appreciate working with you and collaborating with you in this really critical time. And I want to thank also your staff, both your personal staff and your committee staff, who've really been amazing partners for us for many, many years. And we wouldn't be able to advance the issues we care so much about and the people we care so much about without you and your really wonderful staff.
Well, let me just say before I leave you, please, if you could be helpful on the town hall next week. Again,
Yes.
we would like to have people listening and who are dealing with their folks inside. And I'm going to try to see if I can get the speaker and other people to listen, because I'm just not sure my Democratic colleagues are feeling it.
Yeah, we want to be as supportive as possible. Please do share the details. I'll connect with your office about the town hall, and we are going to be sending out an email later today after this webinar is over, and we're sending out resources, and I'm happy to share the information about how people can join your town hall. Not tomorrow, but a week from tomorrow. Is that right?
From tomorrow, yes. We got to do everything we can to raise the profile on this issue. So thank you very much. Thanks everybody for the work that you do.
Thank you.
Thank you.
Thank you. Great.
Thank you.
So we're going to turn to the main event, which is a larger discussion with our speakers we have here today. You've already heard from Sakira and Ahmadou. We also have Patricia Richman joining us. She's the Sentencing Resource Counsel for the Federal Public and Community Defenders. These folks are really wonderful partners of the Sentencing Project. We work together through the Justice Roundtable and have been working for over a month now, many weeks, to try and advance the interests of the incarcerated population and the impact of COVID-19. So I want to thank you all for joining us today and for sharing your insights. I'm going to start the discussion for the audience, ask the speakers some questions, but I also want you to know we want to hear from folks in the audience as well. We want you to be able to ask questions and participate. The best way to do that is starting now. You can begin submitting questions using the question box on the GoToWebinar platform, and we'll get to those at the end of our initial discussion. So please know that folks in the audience now, if you have questions, it's a good time to start submitting them, and then we will get to those at the end. So to start off, I want to just sort of get to the basics. You know, what have you all been witnessing as the impact of COVID-19 on federal prisons, state prisons, local jails, and in community corrections? You know, what are the issues that we need to be clued into of what's happening?
I can start, if you'd like, by talking a bit about what we're seeing in the federal prisons and pretrial detention facilities. I can start with the statistics. They're grim, and they've probably changed since I got these numbers from last night. As of last night, there were 500 inmates who have been confirmed positive for COVID-19, 298 staff, and the number of deaths is up to 17. It may have risen on the 10 minutes we've been on this call. It's important to note for context that these numbers are only confirmed positive, and BOP has reported that there are much larger populations of people who are presumed positive because they're symptomatic and not necessarily being tested. And so what we're seeing in the Bureau of Prisons is a rapid increase that's about 11 times greater than the national increase. As of yesterday's data, there have been a 3,294% increase in the general population of COVID-19, and BOP, 36,450%. The fact is that prisons are tinderboxes for infectious disease, and we don't have the robust testing that we need in order to flatten the curve, and we don't have the mechanisms that CDC recommends in order to stop the spread of COVID-19. Social distancing is impossible in federal prisons. Clients eat, sleep, and shower in close proximity to each other. They share cells that are 6 by 8 with one another, often 2 people in each cell. Or they're in large rooms grouped together with cubicles separating them. They've been in lockdown now for about 4 weeks. The BOP announced on Monday that it would be extending that lockdown. And the reality of that means that for all but 1 hour, clients are locked in their cells and they have their precious time out to recreate, to shower, to use the phones. I've heard reports of, 4 phones for 24 inmates. It's miserable, it's harsh, it's extremely punitive. Hygiene is impossible. Some prisons are providing limited toiletries, but there's not enough to maintain daily hygiene, and commissaries are closed due to the shutdown. Soap dispensaries have been emptied, we are hearing, so that they can be used to clean the prisons. Medically, both clients who are symptomatic with COVID and others who have other non-COVID-19 medical needs are suffering. Healthy inmates remained housed in close quarters with those who are symptomatic. One client who was quarantined with 103-degree fever was moved to quarantine and has been there for 9 days. There are 24 inmates with him in quarantine. They are all in one big room, a visitor center with no partitions, sleeping on cots. The sheets are changed once a week. We cannot speak to our clients. Access is nearly impossible. Facilities are not answering the phone, and when clients can get to some means of communicating with counsel, it's often monitored and not confidential. So in order to make motions for them to be released, compassionate release, or try to put together reentry plans so we can try to seek home confinement, we need to be able to talk to our clients, and we're not getting that access. Testing is still extremely limited. We're not aware of any quarantined client receiving a test for COVID-19. And BOP press releases indicate that 16 of the 17 deceased inmates were not tested until they made it to the hospital. Many are returned from quarantine to their cells or cubicles after being in close contact with others who are sick. I wanted to share one story from the field which demonstrates BOP's failure to adhere to CDC protocol. One client began experiencing symptoms on March 27th. They were hot flashes, chills at night. He was unable to sleep. He had a sore back and lower legs, a loss of taste and smell. 3 days later, on March 30th, his temperature was taken first thing in the morning in his unit. It was 100 degrees. He was sent back to infirmary. They took his temperature again and it was normal. He was sent back to the unit. Many inmates in his unit where he was returned to were experiencing similar symptoms. At 11 a.m., he fainted. He hit his head against the wall. Before he passed out, he was feeling lightheaded and he had shortness of breath. He was taken back to the infirmary, and his temperature was still normal, as was an EKG, so they sent him back to the pod again. At 7 p.m., he fainted again, this time hitting his head on a door. He was taken back to the infirmary again, but still no tests were administered, and he was transferred to solitary confinement, where he was supposed to remain until the next morning until a doctor came. No doctor came, and he remained in solitary for 2 days. He was returned to the unit, and that's where he's been for the last week. Fortunately, he's recovering. His sense of taste and smell are slowly returning. I also want to mention something that I don't think has been discussed enough about the psychological impact of these measures on our clients, many of whom have pre-existing mental conditions. This is extremely stressful and will exacerbate many individuals who have pre-existing conditions, and there has been no attention paid to the extra level of punitiveness that this is simply creating. In halfway houses and RRCs, the situation is also bad. BOP resisted, fought tooth and nail to keep individuals who were in halfway houses who had home confinement plans from being exited into those home confinement plans. I have former colleagues who are litigating those motions. in those places, like DC's own Hope Village. There's a halfway house in Baltimore that is also bad. Inmates can't quarantine. The conditions are unsafe and unsanitary, and they don't have access to good medical care. I was happy to see news yesterday that the Office of Inspector General has started investigating a complaint against the Bureau of Prisons about their handling of the COVID-19 response and investigating conditions, because the Bureau of Prisons and Department of Justice are telling everyone they got it under control. They're saying this in court yesterday, that fears about COVID-19 in the jails and prisons are still speculative, that it's safer in the Bureau of Prisons than out. They are still making those claims. The IG has established an email hotline to report complaints, and I would encourage everyone to take advantage of sharing with the OIG the experiences that you are observing and any firsthand accounts that you have. You know, usually they go to the field and they can inspect a prison, but they can't right now. So the picture that they are getting is skewed, and it's going to be up to us to report out. So that's what we're seeing federally.
Thank you. Ahmadou or Sakira, do you guys have any additional details you want to provide to that grim picture that Patricia painted for us?
I mean, I can speak from the local perspective in the city of Chicago and the state of Illinois. So Safer Foundation is based in Chicago and Cook County. I'm sure that many people who are with us today saw a New York Times article that was published not too long ago that's been keeping track of the number of confirmed cases inside of particular facilities. And I believe that Cook County Jail, the local jail in Chicago, has more confirmed cases than any other facility in the country. So we've got about 492 confirmed cases, at least as of this morning, 2 deaths as of a couple of days ago. We have in our state prison system 146 confirmed cases in different prisons. Stateville Prison, which is a prison that's not just outside of Chicago, is also on that list that was posted on the New York Times, just a little south of the numbers that exist in the Cook County Jail. But what's also been happening at the local level is that people who've been out already and people who have initially had a place to go in housing are in need of subsequent housing. And this is happening at a time when the transitional housing stock and the number of shelters that are available are already becoming tapped out, and they have been tapped out for a couple of weeks now. So people are coming to Safer Foundation and to other reentry organizations in need of help, in need of housing, and there isn't a whole lot to go around. Local governments are attempting to respond, and in many instances doing so, but the supply is never enough because there's such a great need, especially as increasingly folks are being released, however slowly that is happening. So that's a slim look of what's been happening at the local level, at least within the city of Chicago.
And I would just add that I've seen, and we've been tracking similar cases in New York and outbreaks in California, and the response, as Ahmadou said, to those outbreaks, some in Michigan and places that are hotspots generally. I think there's a strong correlation between hotspots in the country and what's happening in jails and prisons in those localities. And those are really concerning. But what we have also seen is that in a lot of places, governors, local officials have done the right thing and have issued executive orders trying to release people, more people, those who are nearing the end of their sentences, those who are particularly vulnerable. Jails have lowered their daily intake rates in a lot of places in California. That happened, but it still isn't enough. I think in New York, one of the most egregious things with respect to community corrections, there was I think one of the first individuals who passed on Rikers was an individual who I think he was 43 years old and had been returned on a technical violation. He was out on parole or probation and was returned to Rikers because he missed an appointment with his probation officer in the midst of a pandemic. And so, I mean, and then he died. And that's just, sort of indicative, I think, of what Patricia talked about that's happening federally, but also what Ahmadou talked about what's happening in Chicago. And there isn't as the Congresswoman noted earlier, there is a lot of attention being placed on the problem, but not enough on the solutions and what both local officials have already done in some places and what more can be doing, and then what the federal government can do, both for federal prisons, but also to incentivize state and localities to release more people as well.
Absolutely. So, Sakira touched on some of the responses, the state and local level as well, in particular. I mean, Patricia, do you want to talk about a little bit some of the federal response that we've seen regarding the BOP?
We've seen a broadly inadequate federal response. Sorry, my webcam, I think, is not working. Can you guys still hear me?
Yeah, we see you too.
Yes.
Okay. What we've seen from the Bureau of Prisons and Department of Justice is a lot of talk but little action, and that's due to a lot of contrary and conflicting guidance about what needs to happen. And so we are not seeing the kind of reduction in prison populations that really is necessary in order to stop the spread and flatten the COVID curve. In court every day, the Department of Justice is fighting motions to release clients from pretrial detention where there's a presumption of innocence, and that includes clients who are not in there for nonviolent drug offenses. And by the way, I would object to the distinction between so-called violent and nonviolent offenses. Anybody who is in pretrial detention has a presumption of innocence, and anybody who's in prison is generally going to re-enter the population at some point, regardless of whether it's a violent or nonviolent offense. So I'm not trying to go on a tangent there, but these individuals are in pretrial custody. The government is opposing their release and seeking their detention. That's occurring in the Bureau of Prisons too, and we're trying to use our existing mechanisms to get them out. And there's absolute lack of transparency about what is actually happening. And so all of these really scary reports are coming out from incarcerated individuals and prison staff that is contradicting the rosy picture that the Department of Justice and Bureau of Prisons is trying to paint.
So what about Congress? So that's what the deal is. Congress has taken some steps, through the CARES Act, as Sakira mentioned, to provide aid to state and local governments in their response to the pandemic for injustice-involved folks, and expanded the authority, in theory, for the Department of Justice to transfer more people to home confinement. How has that been implemented, both at the state level? Are people getting funds through the CARES Act? Are state and local governments getting funds? Is the BOP doing what Congress wanted? Is there any good signs happening, or is it all, Sakira talked about some releases, but not enough. How much more needs to happen, and how can Congress be helpful? And if you could talk also about, yeah, go ahead.
So I can respond to the first part, and maybe Ahmadou will kick in here about resources, state and locals, and then maybe Patricia will talk about the lack of adequate response from BOP, even with Congress's expanded authority. So Congress, under the CARES Act, appropriated $850 million to state and local law enforcement. It goes through state governments to respond to the coronavirus. And the language of the statute is pretty broad in how states, how the money can be used. The money is through a Burn JAG grant program that is an existing program, federal program, that state and localities can apply for resources, can apply to receive resources through. The first sets of grants have gone out. I think it's about $70 million have already gone out to some states who've already applied. The solicitation is open. One of the pieces that was missing, though, as I noted earlier, the language is pretty broad in how it can be interpreted for the use, is that, what we envision that will happen is that states will apply for the money, local law enforcement or jail officials will be using it for overtime, for staffing, for PPE for staff. but we want to ensure that that money also goes to those who are in prison, right? For testing, for PPE for prisoners, for healthcare and hygiene support, and it can be used for those resources. And so it really will be incumbent upon advocates working at the state and local level to be pressing their local governments around how those dollars will be used, and also be pressing them to use those dollars to create an infrastructure for more release, because they can do that, right? There is the ability to use those resources, facilitate release of people in jails at the local level, and to disincentivize arrest, right? We don't want law enforcement arresting people for things that they can cite them for in this moment. I mean, we have made recommendations around increasing cite and release, no booking, no new bookings, deferring people from commitment as much as possible during this coronavirus pandemic. And now the states have the money and the resources that they need to be able to do all of those things. And so that's what we're pushing for that to happen, and that in the next package, Congress plus ups that money, because $850 million across 50 states is like not a lot, right? And it's not enough. And also the way the grant solicitation, the funding formula was articulated, there is a windfall for sheriffs in most of these places. And so it's a concern, even though sheriffs do control jail populations, there are still prisons that also in states that need to have access to these resources. So a plus up in the next stimulus around this funding opportunity with some real guidelines and restrictions for how it can be used is a critical priority of our organizations.
Yeah, and I can follow that up. I mean, in our state, there's just a general shortage of PPE. I was reading an article yesterday where our governor, the state government, chartered a flight to China to try to midnight hour some PPE out of China and bring it back to the state of Illinois so it can be distributed throughout the state. My understanding of what's happening in correctional facilities throughout the state is that individuals who are symptomatic are being quarantined and hospitalized as needed. Is that happening to scale? Is that happening in an ideal way? The cynic in me would say no, but there's nothing that's happening perfectly these days. I would also say that with respect to the provisions of the CARES Act, the emergency solutions and the CDBG provisions in particular, those are making their way down to the county government. The problem is it's not enough. So they're standing up, transitional housing. They're bringing different hotels and things of that nature as quarantine sites and transitional housing for people who are leaving the local jail. But the challenge is, again, it's not nearly enough because we had a homelessness problem before this existed. Then this happened. March 1st, probably by March 14th, transitional housing shelters and homeless shelters were already tapped out. And now they're even more tapped out to the point where we're trying to find additional additional properties that we can bring online to support the effort. So at least where I sit, and in my opinion, the reduction is not happening fast enough, and it has not been large enough. That said, I will give our state government some credit. The governor has basically issued 2 executive orders. One is a medical furlough for people who are incarcerated, so that they can temporarily be released to deal health-related issues. The second is a notification to waive an executive order that waives the 14-day requirement to notify state's attorneys if people are being released. Some people have received executive clemency, though it hasn't nearly been enough. I mean, we're talking about a number of people in the teens. So there's some work that states are trying to do, at least the state of Illinois is trying to do, to address this challenge that's right in front of us. Some resources are making their way into the places that they need to, but it's not nearly enough right now, and we need Congress to do a lot more, is what I'd say.
And I can speak a bit to the federal side of things. So I think there are 2 ways that Congress has given us tools to try to get clients to a place of safety. One was in the recent CARES Act, where they authorized the expansion of Bureau of Prisons' use of home confinement. Another was in the First Step Act when they removed BOP's chokehold over the compassionate release process. And those are the tools that we're using to try to get our clients safe. So the CARES Act passed on March 27th, and it authorized this expanded use of home confinement by Bureau of Prisons. Now, home confinement is not ending someone's sentence. It's just transferring them to serve the remainder of their sentence in a different place. But rather than use these tools effectively, DOJ waited to make the declaration necessary in order to trigger the expanded home confinement authority, and then erected a series of non-congressionally mandated obstacles that are arbitrary, have no connection to the public health crisis, and are racially disparate. BOP's implementation, full stop, has been opaque, chaotic, and puts our clients' lives in danger. Simply put, despite legislation and even AG Barr trying to loosen up some of his criteria, BOP is not using home confinement to transfer our most vulnerable people to safety. Just a brief recap, on March 26th, the day before the CARES Act was signed into law, and everyone knew that this was going to become law on March 27th, AG Barr issued a memo. And in that memo, he had this laundry list of factors of who could qualify for home confinement. And among those factors were things like, do you have a score of minimum on pattern? Pattern is the risk and needs assessment that DOJ created in order to predict someone's risk of recidivism for purposes of earning certain incentives in the Bureau of Prisons. Number one, it has nothing to do with whether or not you're medically vulnerable and need to be gotten to a position of safety. Number two, it's not validated. And there are many indications that it results in racial disparities in how people are classified for risk. He also required a mandatory 14-day quarantine before somebody would be transferred to home confinement. And that's a problem, right? Because the reason they need to get out of the Bureau of Prisons is because of the inability to quarantine. Yet Barr's March memo required those things. A week later, he finally made the emergency finding and appeared to broaden those criteria and said that anyone with a suitable confinement plan will be an appropriate criteria for home confinement. And that memo says 14-day quarantine can happen at home. BOP doesn't seem to know what guidance to follow. And so they're still treating those March 26 criteria. Seems like they're still using those as an eligibility cutoff. They are also still apparently not embracing the idea of a 14-day quarantine happening anywhere but in prison. And indeed issued some phase 6 guidance, which makes clear that quarantine means a trip to solitary for everyone. It means putting people in isolation. And I should add that that's not an effective way to quarantine people because many of these facilities are very old. They recirculate air. They're not simply putting somebody in solitary is not going to protect them from getting the virus. BOP now says that it's put more than 1,000 people on home confinement since March 26th, but that figure is misleading at best. For one, this quarantine appears to be happening, impeding anybody actually reentering the community. So it seems that BOP is number one, including people in that number who have just been approved for home confinement. Another thing about that number is I think it includes a lot of people who were in RRCs. So after 3 weeks of fighting tooth and nail to keep people in halfway homes, there in these many instances, unsafe and unsanitary places, they finally released them. And a number of people have reported from various sources that they've been sent to quarantine and then brought back out and told that, after further consideration, they don't actually qualify for home confinement. There's a lot of ACLU-led lawsuits going on right now, which are challenging the conditions at various facilities. There was an affidavit that was submitted in one of those recent lawsuits in Oakdale, Louisiana, which laid out a system that they were using that started off with a list of 58 people to be considered for home confinement, and then only 6 of those people were found to qualify. And I want to be clear that that 58 list was run using those restrictive criteria that Barr had articulated. So these are already people who are fitting into that very narrow class he's identified. And even still, at least when they filed that a week ago, they were making these limited swipes. And so the problem is they're dragging their feet, they're confusing the process, they're not getting their head around the severity of this issue. Compassionate release, which is the other tool we have, and that, in contrast to home confinement, shortens a sentence. It gets a medically vulnerable and ill person out of the Bureau of Prisons. The government is generally opposing those motions with few exceptions. I want to share just a couple examples of that. There was an 84-year-old I'm sorry?
Just one example. I hate to cut you off, but I do want to get to some questions from the audience. I'm sorry.
Sure. Yeah, no problem. I get carried away with this stuff. It's pretty outrageous.
There's so much information.
Yeah. But there was, I guess, just one more egregious example was there was an 84-year-old inmate with severe dementia. This was a man who had no idea where he was and wandered around the facility looking for his wife. The government opposed compassionate release for that client, saying that it would minimize the fraud crime he had admitted. So this is all discretionary. AG Barr could tell his prosecutors to stop opposing marriage.
Thank you. So I just want to, transition. I want to get some questions from people in the audience, but I do want to sort of just quickly review sort of what are we going to do? Like, what are our next steps, right? There is going to be another package we expect to move through the Congress, probably in May, in the House and the Senate. We're calling it sort of informally COVID-4. There are at least two pieces of legislation, actually a list of recommendations that the Justice Roundtable has put together. The Sentencing Project is a member of the Justice Roundtable. There's a long list of recommendations in this document that we've sent to Congress a couple weeks ago. We can provide a link on one of our slides here so you can check it out. We urge you to reach out to lawmakers in the next coming week to 10 days and tell them not to forget about incarcerated people. There are two bills in particular that the Sentencing Project and our colleagues are supporting. One is called the Emergency Community Supervision Act, which would impact people in federal custody, create a system that would allow the release of people over the age of 50 or who have chronic health conditions and who are within a year of release. There's also a bill called the COVID-19 Correctional Facility Emergency Response Act, which Sakira mentioned. That was introduced both in the House and the Senate. It would provide funding, $1 billion for states and localities to incentivize early release for people who meet similar criteria, 50 years old, chronic health conditions, that kind of thing. Our organizations, there's a lot of stuff. I don't know if Ahmadou has other issues he wants to point to, but I would encourage everyone to look at the Justice Roundtable recommendations and be in touch with all of us, with me, to learn more about how you can take action. If we could switch our slide, I'm going to ask my colleague Morgan to switch slides. We have some resources that we'll here that we can share with you also in a follow-up email to this after this program. Includes our take action on those two pieces of legislation that I mentioned, the Justice Roundtable recommendations, and also the complaint, the DOJ COVID-19 complaint hotline that Patricia mentioned earlier. That's for folks who may have a loved one who is incarcerated. If you have concerns about how the Department of Justice has been responding to people, the issues your loved one is facing regarding COVID-19, please look into using that. They need information, and we want the Inspector General's office to do a thorough investigation. Do you all have any sort of final thoughts before we offer some time for questions on next steps?
Yeah, I do. I would just say that, I coordinate a call with a network of providers in the Chicagoland area and Cook County, and we hop on the phone once a week and we talk to the DOC and the governor's office about what's happening and what the needs are of people who are returning back home. And I would just say that there are a couple of things that hopefully advocates who are on this call and individuals who are on the panel would sort of take with them. First is that we need a lot more housing. There needs to be, we just don't have enough. Certainly not in the state of Illinois. And I think I've said that enough, but it can't be said enough. We need the federal government to be a lot more flexible on grant requirements and program requirements. Individuals are being released from incarceration right now at a time where many DMVs are not declared as an essential service in many state governments. Folks don't have IDs, they can't sign up for benefits, things of that nature. So we've got to be thoughtful and mindful about the world that people are reentering back into and the things that are necessary for them to come back home. We need government to scale up their benefit program operations so that it's way more responsive. It's just being acutely felt amongst the folks who are reentering right now. And then we also need a workforce development response from congressional leaders. This is not going to last forever. The last time we had a recession, the unemployment rate amongst people who have arrest and conviction records was about 27%. That was a national unemployment rate during the Great Depression. And so it's just important that we be mindful of those things as well, because the world that people are returning back to is not what they were used to. And I would just say in closing that it's important that people contact their legislators, contact their elected officials at every level of government, and just let them know that they need to be mindful of the needs of people who are leaving prison and people who are in pretrial detention and in prisons throughout the country right now. That there are a lot of resources that have already been highlighted that are needed.
Thank you so much, Ahmadou. Morgan McLeod, who is our communications colleague at the Sentencing Project, do we have any questions for us?
There's lots of questions. I will kind of summarize a lot of them right now. Going back to your point on this last slide about the response complaint line, there's a lot of questions from families concerned about their loved ones, particularly when they're saying that they have underlying health conditions that really makes them vulnerable to COVID-19. Is the suggestion to go to this hotline, or is there anything else you want to add to that?
So I would say that going to the hotline is good. I would issue a couple of caveats to anyone who's thinking about reporting out about a specific person. If you have received the information from that person, like by text or from a contraband device, please be sure not to necessarily include that as your aspect of reporting. And, be aware that there are some examples of retaliation occurring when clients do speak directly to the OIG during the course of their investigations. However, generally, I think the most powerful information they can hear is the information directly from firsthand from family members, or even if they can speak directly to people. So if you can share that, you should. If you can get in touch with your local federal defender's office, they can often help offer resources. And I know that there's an effort afoot to gear up on strategic litigation. We have a huge pro bono machine in place that is working on compassionate release motions that FAM and NACDL and Washington Lawyers Committee are running. And I know that federal defenders are working really hard to help people put together reentry plans so that they can get placed on home confinement where possible.
There's also been messages around correctional staff who want to speak out about what they're seeing. Would you recommend that they follow the same guidance?
Yes, I think that congressional staff are a really important voice and should certainly make use of the hotline. And they have less, I think, of the other concerns that might be true for incarcerated individuals.
Then we got several questions regarding release requests for COVID-19 using language around non-violent offenders and excluding people who were convicted of violent offenses, and how we can advocate to make sure that they're included for these releases.
We share that concern. I don't know if Sakira wants to take that question. We share that concern, and part of the reason why we are supporting the bills I mentioned, HR 6414 and HR 6400, is because they do not make those exclusions for offense type. They make determinations on suitability for release based on who that individual is now and what present threat to public safety they currently present. And so that's been really critical in our advocacy at the Sentencing Project and at the Justice Roundtable. And I know my colleagues here participating on this panel share those concerns.
Yeah, I mean, I agree with Kara. the leadership conference led several letters to mayors, associations, governors associations, and sheriffs associations that talked about the ways each of them could release people in jails and prisons in their localities, and were very careful about how we framed release. And it was, like Kara said, it was all about the people. It's all about the risk, risk of the virus to those people, right? People who are older, people who are particularly vulnerable, people who are within a year of their sentence, et cetera, and releasing as many people as possible, right? Eligible people as possible. And I think for the long term in our movement, we have to be very cognizant of not making this false correlation between violent and nonviolent, and talking about individuals as who they are, and the humanity of everyone, and the fact that everyone deserves equality and equity and the administration of justice.
Yeah, I'd like to speak to this briefly. I think it's important for us to be mindful that although there's a pandemic going on right now, it can't be lost upon us the importance of maintaining good relationships with our press contacts and folks that we do work with locally to kind of get our messaging out. We're living in a time where, the releases maybe have been happening in a lot of states for a couple of weeks. The local law enforcement agencies and unions are starting to organize and put their messages out into the press. I know that's certainly happening locally where I'm at. And right now we don't have a collective response to drive an alternative narrative behind why it's both smart and the right thing to do to be releasing people during this particular point in time. So there's a little organizing, but also some message driving that we need to be doing as well back in our communities.
Do you want to do one more question?
I think we have time just for one more.
People have been asking what measures are being considered for youth, for people in juvenile detention centers.
Does anyone want to take that, Sakira?
I know that similar to what's happening in adult facilities, people have been calling for immediate release of all youth in detention. And
even for those convicted of violent offenses. Sorry.
All youth, all youth in detention should be released. That's what our recommendations have been, immediately, and also supporting their reintegration into the community. And some of the organizations that are leading the way on this are Campaign for the Fair Sentencing of Youth, and a number of others that we can connect folks directly with post this call, who are really, sort of, like I said, leading the charge on this at the local level and also federally to get more resources to decarcerate youth in prisons and jails around the country.
Yeah, and I know the Coalition for Juvenile Justice has also been advocating for this next stimulus package regarding COVID-19 to have money specifically for youth who are in detention. I think there initially have been discussions in the COVID-3 that had the CARES Act that there be at least $100 million, and that for some reason was stricken. And we would definitely like to see that money put back in to make available to young people in particular. Great. Well, thank you so much to everyone, to Ahmadou, to Sakira, Patricia, and Morgan from my office, who is our wizard with all webinars. It's a really wonderful conversation, and I'm glad that we're able to get the important information out there to folks. I'm thankful to Congresswoman Karen Bass as well, to sharing her wisdom with us. I know she is doing her best to talk to leadership, including the Speaker of the House, about these issues, about why incarcerated people should not be forgotten during this time. It is really dependent on all of us to raise our voices to make sure that they are not forgotten, because it is out of their control. They are dependent on the government to make them safe and to protect their health and to protect their lives. This is not normal times. These are life and death situations, and all of us need to act as forcefully as we can to make sure we are protecting everyone from this terrible virus. So please do be in touch. We will be sending an email later today with these resources. We want to, get as much attention and pressure placed on Congress to make sure that more funding is made available to protect people who are incarcerated in this next stimulus package. So thank you all so much. And I hope we will be in touch again. I know the Sentencing Project is planning to do future webinars around the COVID response as well as on other topics. So I thank everyone for their participation today.
Thank you.
Thank you.
Thank you.
Thank you.